Hello, everyone. Welcome.
Hello, group.
So if you've joined us before, you may be noticing something very different this week, that we actually have a non-avatar version of Jeremy this week. Yay. Which
I'm
means
sorry that this now really degrades the quality of the workshop we're giving, now that you have my ugly mug.
hello, Tyler from Sudbury. Thank you again for joining us. Awesome. Okay. Give everybody a couple of minutes to join in before we get started. Hello from Vancouver. What's it like out there today? Are we rainy? We've been getting just a ton of thunderstorms in Edmonton. It's very wet here. Sunny. Oh, nice. Good. Excellent. How's your weather been, Jeremy? Dry down there, or are you getting some storms as well?
Yeah, so this desert climate we're in is a lot less desert-like
Okay.
nowadays.
Right. Yes.
Not nearly as bad as what the rest of Alberta's getting, just enough so that your grass isn't always on the verge of dying. So it's great that way, right?
So interestingly enough, Jeremy's from working out of Suffield, so he lives in Medicine Hat, and I actually went to university in Lethbridge, so down around the same area, and it is actually considered a desert down there. So you probably don't think of Canada as having desert, but we do actually have a desert down there.
Based just on how dry it is, and I assure you, it's a very, very dry climate.
Yes.
Like my skin just scales up in winter, no matter basically what I do. And yeah, your lawn, like to keep a nice green lawn, very, very difficult.
Oh, yay, a fellow pronghorn. Yay. Woo. Don't meet too many of those. Excellent. Woohoo. Jeremy, you went to Calgary, did you not?
Yes, but again, don't hold that against me. I'm really an okay guy.
Awesome. All right. Well, maybe we will get started then. So I'll let Jeremy introduce us today.
Yes, let us. So this is episode 4 of what was always envisaged to be a 6-episode series. So today we are going to be talking about foam rolling and self-myofascial release, sort of like what this is and how it can be useful, and if so, how to do it, in an effective way. And then after this, we're going to be talking about neutral spine in future episodes, that is, neutral spine, and especially neutral spine having to do with the force evaluation specifically. So yeah, great episode today. Really big show.
All right, so I'm Heather Garreau-Miller. If you haven't been with us before, I'm the health promotion specialist in Edmonton. I am a registered kinesiologist, as is Jeremy, but Jeremy is joining us from Suffield as the reconditioning specialist down there. So we are going to defer to his area of expertise through these sessions and let him be my expert.
Yes. Right. Having said that, of course, this is not an academic discussion because I'm the last person that they would ever let conduct an academic tutorial on any matter, especially exercise physiology. So don't let that distract you.
So as you know, we need to read through our disclaimer. Before we get started, the presentation you are about to view is the intellectual property of the Department of National Defense. Any reproduction or retransmission of the slides contained in this presentation is strictly forbidden. Some of the topics discussed in the webinar may be of a sensitive nature and may not be appropriate for children. Parental discretion is advised. Please understand that people's stories are theirs alone to tell, and anything that is shared by participants in this webinar, either on camera or in chat, is not to be discussed outside of the webinar. This webinar is being recorded and will be available for later viewing on the CAF Connection. That's happening quite quickly these days. Though active participation is encouraged, you may simply follow along without using chat video or microphone options if you prefer. So just finding out who our audience is again today. Just give us a click there. Right. Missing some few there, but that's okay. All right, thank you very much for that, everybody.
Okay, so I think it's my turn to speak up. By the way, if you're noticing that my avatar is holding what looks like a Starbucks cup, that would be because I drink way too much coffee, as we learned about in my daily nutrition challenge. But I digress. So yeah, we're going to, at this point, just cover the 5 main points that we'd like everyone, we hope everyone walking away from this webinar will have learned a little bit about. So the first one is what fascia is and why anybody should care about what it is, especially from an exercise physiology standpoint. Okay, so the second is keeping your fascia flexible and healthy so that you can move properly. Third is recognizing fascia pain and being able to distinguish it from other types of pain. I assure you that this is a helpful distinction to make. Fourth is relieving fascial pain. Now, of course, we're not going to be covering this from any sort of a medical standpoint, right? But from the standpoint of, well, you know, look, we're talking about self-myofascial release here. We're talking about foam rolling. It's not uncommon if you get prescribed physical therapy for the therapist to recommend foam rolling. So in any event, we're going to cover using some of the tools of the trade to relieve it. And the fifth is a very specific tool of the trade, which is self-myofascial release. And so yeah, so that's our webinar in a nutshell. So let's get going on the specifics now. So the first is what fascia, just bear with me because I got 2 screens going here. Okay, so what is fascia and why should you care? All right, so well, I assure you that it's not just an academic point here. So a textbook would tell you that fascia is connective tissue with a lot of, you know, collagen fibers. But what does that actually mean? Okay. Well, it's a specialized cell. This is, if you look under a microscope, so on the left of your screen there, okay, what you could mistake for a spider's web or a cobweb. I don't even know which it is, if it's a cobweb or if it's fascia. I think it's fascia there, right? That's what it looks like under a microscope. So it's sticky. It attaches things together. It's surrounding every bone, every organ. It has a protective aspect to it, which we're going to learn more about as this webinar goes on, right? It's not well organized. Like if you look at muscle cells, you know, they're in rows, they're, you know, stacked one on top of the other. It's very organized. Fascia's not like that. It's, as Phoebe from Friends would put, it's all chaotic and twirly. Okay, if you look at that orange there, right? So on the right of your screen, in some ways it's a helpful thing to compare fascia to that pulpy stuff that's between the outer layer of a peel of an orange and the innards of that orange, right? It's in between these two things that matter. So in a human body, this would be the skin and the muscles, which is the innards. So the fascia is in between there, right? And it's connecting, well, it's between the skin and the muscle, and it's connecting the two. So when a muscle contracts, when the body is moving through muscular contraction, there isn't direct, well, at least if your fascial layer is healthy, there is actually not a direct connection. There's not direct friction between that muscle and the inner layer of the skin. Instead, each of those is connected to the fascial layer, okay? So it is, of course, not the same, however, as just the white pulpy stuff inside an orange. It is innervated. So that just means that there's neurons in there. Now, these are not the type of neurons that muscle has Fascia doesn't produce human movement in the way that skeletal muscle does. It doesn't produce force, right? It's a very important role. That's not one of its roles, right? These neurons are sensory. And so if fascia is injured, if it's diseased, if it's irritated, then the body has a way of sensing that. And of course, it's not a pleasant sensation. It's painful, okay? So before we move on, I just want to clarify what this stressful, so I've just mentioned that if fascia becomes irritated, we sense this, like we sense it as pain, right? What do I mean specifically by that? Well, there are some diseases that can irritate fascia. And since this is a physical fitness centered workshop, we're less worried about those here. We're more worried about, well, for example, trauma, like acute trauma. If you suffer like an impact, right, there's a potential for fascia to become damaged there, right? Now, beyond that though, chronic stress can actually also irritate fascia. And this is something we talked about. I don't remember if it was in episode 3 of the series or episode 2, but for example, if you think about the iliotibial tract, which I think we may get into in as this webinar progresses, it's a lot of fascia around the upper leg, right? And if when we are running, that femur bone is rotated a little bit off, there can be friction in that leg that irritates fascia. I mean, it's not going to happen like the first time you do it, the second, the third, but you run enough, right? Build up enough of this chronic stress, fascia doesn't like that. It becomes irritated. It just becomes more dense, more sticky is the way to think about this. That's the big point. It's more sticky, right? So that now if we have skin and we have muscle and they're supposed to be moving past each other with the help of fascia, well, it's not going to move as well, right? So it's basically, we're going to get less movement quality in this state. And just last point before we watch a great video on this, there's 3 main sources of fascia becoming irritated. So one, or 3 sources of stress. So from a movement standpoint anyway, one is not moving enough. Okay, so being too sedentary. Just like sitting in place or maybe standing in place. Fascia does not tend to like that. That is a risk for fascia becoming irritated. Another is the inverse of that. It is moving too much, especially if your movement quality is low. So I just laid out an example of that, right? Like running with, well, a pronated foot, for example. This can also cause it, right? And then the third source is I mentioned it previously. It's trauma, it's surgery, it's disease, right? So this workshop is going to be heavily focused on the second of these, which is, and to an extent the first, which is how to use movement to not only not irritate fascia, but also to use movement to help fascia to be even healthier. So I think this is the point, Heather, where we have a video, right?
That's correct. So Jeremy, if you could just remember to mute yourself before.
Thank you.
Between the skin and muscle, there's a layer of fibrous connective tissue called fascia. The fascial layer is a sheet of connective tissue fibers composed primarily of collagen that forms beneath the skin to stabilize and anchor muscles and other internal structures. In a healthy system, the muscle will slide and move without restriction. When a muscle becomes injured, the rate of collagen product by local fibroblasts is increased. The fascia becomes extra dense and facial adhesions are created. Overproduction of fascial adhesions can affect mobility of corresponding muscles and joints. Fascial mobilization helps release or loosen fascial adhesions in order to promote healthy range of motion and prevent injury.
So Jeremy talked about what could cause that fascia to become problematic for us. So on the reverse side of that, what can we do to keep that fascia flexible and healthy? Keeping your fascia flexible and healthy obviously has a lot of benefits for us. You'll move more easily, you'll have a larger and better range of motion, and you'll just experience less pain. Things that can prevent fascia problems include, as Jeremy said, when we're sitting too much, fascia can become problematic. So just thinking about moving more, in addition to having a varied fitness routine, so you're not always just doing one thing. And Jeremy can probably really speak to that as a triathlete, because there's so much repetitive movement there. When we look at people that really have that addiction to running, they tend to have a lot of problems with issues like that, because they tend to focus on one type of activity rather than moving around in lots of varied ways. As well, thinking about if you have a desk job. If you have a desk job, more important than anything else when it comes to pain from sitting down is getting up. It's moving around, getting up at least once an hour, and we recommend at least 2 minutes an hour that you're getting up and not just standing, but actually moving and trying to move through a range of motion. So bend and lift those legs and walk around, and that's really going to help with any kind of fascial tightness that starts as a result of being sedentary. The second one would be to stretch. So we know that stretching is good for our health. It reduces the inflammation, and it can reduce structural problems in the body. And interestingly enough, when we talk about self-myofascial release, the research that we have currently shows us that when we attach either dynamic stretching for pre-exercise or static stretching for post-exercise with that myofascial release, we get better outcomes. So those are both really positive for us. Thirdly, it would be thinking about your posture. So trying to maintain a good posture when you're sitting at your desk. I know I am very guilty of this. When I get really focused on something, my head gets closer and closer and closer to the screen as I become more focused. So really thinking about your posture, taking those posture breaks when you can, but also when you are looking at activity as well. If you have anything that's kind of problematic in your body, you may be having some of those compensation patterns that we talked about in an earlier webinar that actually can be impacting your posture as well. So thinking about that piece in addition to that. So if you have that desk job and there's opportunities that you see to get up besides that 2-minute break, you're taking a phone call, get up and take that phone call standing. If you're on a conference call or if you're on a webinar, you can stand up and you can move around. Nobody's watching you. You can just push back that chair and move about as you're listening. And the last thing we talk about with keeping fascia flexible and healthy is actually hydration. So fascia can be up to 25% of the water in our body is contained in that fascia. So obviously, as a result of that hydration status that we have throughout the day can really impact how that fascia is feeling. And obviously, the last piece would be that self-myofascial release, which will be today's topic. So recognizing that fascial pain. Is it fascia pain? And that's can be kind of difficult to determine whether it's due to muscle pain or joint pain or fascia pain. It's kind of difficult. In general, when we look at a muscular injury or a joint problem, they feel worse when we move. But in general, when we have fascial pain, it likes movement and it feels better when we move. So that's really going to be the biggest indicator when we do that myofascial release or we do any kind of heat therapy. We're increasing the tissue's elasticity and it feels better for us. Yes, Jeremy. Absolutely.
So it's absolutely true to say, in the main, that movement, because it increases circulation, mainly, if you have a fascial injury, if that's where your pain's coming from, then moving will make it feel better. Now, having said that, though, especially if it's IT band friction syndrome, like, it's not that like when you first move, the pain will go away, like from cold. No, it's just that over time you stop feeling the pain as you move, right? So if just a small distinction there, but it's just like if you have the type of pain where the moment you start moving, it doesn't go away, it takes a few minutes, that could still very well be fascial pain.
Yeah, for sure. So when we talk about relieving fascial pain, and I mentioned a couple of them already, it'd be heat therapy. Applying a heating pad or taking a nice warm bath or shower can alleviate some of that sensations that we're having. Yoga therapy or any type of movement that really encourages full ranges of motion is really going to be beneficial for the fascia. Massage therapy, which in and itself is really self-myofascial release done by somebody else. So take out the self and it's myofascial release when we look at massage. So it's just somebody else doing it for you. And then when we look at physical therapists, some treatments and some specific diagnosis might benefit from acupuncture or intramuscular stimulation, and that may benefit the fascia as well. Obviously, today we're talking about foam rolling or self-myofascial release as the way to relieve that foam rolling. Having said that, it's important to recognize that people experience stiffness and tightness and tension from time to time, and that happens in healthy individuals, and that is the population that we are talking about today. However, if you have chronic pain or severe pain, that might be an indication of a significant health condition or an injury, and in which case we highly recommend that you're seeking treatment from a physiotherapist or other allied health professionals before moving forward with any kind of myofascial release. There can be, and there may be, a lot of benefit for you for doing that myofascial release when you have that condition, but we would really encourage that you're doing that under the guidance and direction of a health professional and not just taking it upon yourself at that point.
Not just something that we're telling you because it's politically correct. That is absolutely true, because if you, again, just to use a example that I happen to be very familiar with, if it's IT band friction syndrome that you have, right? Myofascial release is likely to not be a complete cure for you, and it may not actually address the problem sufficiently or even a lot, right? Depends on what this is coming from, like what has caused this, right? That is what physical therapy can help you get to the root of and to cure it, right? If it needs physical therapy, right? So, like the truth is that there are people out there who are using self-myofascial release, and they're just, they think it's a cure, right? The title of this workshop is foam rolling, is it a circle of death, or is it, is it something better than that, right? And the truth is that, like, if you are using it properly, this is not a circle of death. It certainly doesn't have to be, right? So using it properly is key, which is kind of the focus, like, of now the slide that we're on, well, this stage of the webinar. So we're going to start by addressing when you do this type of thing, okay? Now, we're going to start with a point of clarity. I'm using this term foam roller and foam rolling a lot, okay? And that is for lack of a better word, right? There are, in fact, some types of devices you can use that are not made out of foam and they're not tubular, okay? But it's just, we'll get to that. All right. So when do you do self-myofascial release? Well, it's actually fairly hard to go wrong here. You could do this before exercise. You can do this during exercise. That's a little bit uncommon. But you can do it after exercise. Any of these is a great time to do. It's hard to go wrong. There's well, I wouldn't say like self-myofascial release constitutes a warm-up. Like, if I had to recommend warming up, this would not be the only thing that I put in there. I'd have movement activation, right? But it's certainly better than nothing. It can increase circulation. There's fairly good evidence for this, right? Yeah, just a brief note on like doing this while you're exercising. fairly uncommon. If you're at the stage where you're doing self-myofascial release during your exercise, it's probably because what you're doing in physical therapy. I had to do this when I had to learn how to run again. My IT just completely blew up, and I had to learn basically how to move again. And so that's, I was like running for like a half a kilometer, so a few minutes, and then foam rolling, and then, fairly uncommon. All right. So point is, before, during, and after, not a bad thing. It is certain, however, I will say, for best results, especially for warming up, using dynamic stretching along with foam rolling, that tends to be a fairly effective way to do it. Okay, so the key word there is dynamic stretching. What does this mean? Dynamic is just stretching done, so it's elongation while you're moving, as opposed to while you're stationary, right? So for example, you see this all the time. I swear to God, even Olympic athletes, I see this. Like before they run, they stand around and they do this, right? Haven't you all seen that, right? Like static stretching by high performance athletes before they run. Yeah, I wish that practice would die, because muscle length, there is a relationship between muscle length and power output and basically muscle function, right? Muscle function is ideal. You tend to get the best results when muscle is at its resting length, not when it's elongated, not when it's too short either, right? So anyway, that is a little bit of a reason why you should be cautious about stretching, especially static stretching, like the type I just showed you before you exercise. Heather's everything okay?
Yeah, I'm just putting in the video for somebody, but I'm trying to translate it over here. So sorry.
Okay. So yeah. And for dynamic stretching, by the way, if you're a military member or you were a military member, you would know from force evaluation, it's got dynamic stretching built into it. It's like when you're crossing one foot over the other, and you're stepping to the side, or if you're walking and you're kicking your leg up and you're reaching opposite hand to foot. These are examples of dynamic stretching. So combining that with myofascial rolling. All right. As I said, though, briefly, it is also good to use it for recovery from exercise. Now, why is that? Like, what do I mean by that? Well, especially if it's intense exercise, there is some reason to believe that it can condense, it can shorten the period of delayed onset muscle soreness and potentially reduce the severity. Now, I'm not going to go overboard and guarantee you that this is necessarily what foam rolling can induce, but there's some evidence for it. And by the way, I don't actually think it's a startling claim to make that using foam rolling can help you recover from exercise, because I wonder if it's just the fact that, like, if you compare foam rolling when you're done exercising for a few minutes, as opposed to doing jack for recovery, so just sitting at a table and sipping coffee, for example, like, it's just like there's a little bit of movement involved with self-myofascial release, and I think it's very possible, and I wonder if it's just a metabolic effect of just basically it's light exertion, it's light exercise, especially if done in certain ways, right? So, but whatever the cause, there is some reason to believe that it might be able to reduce muscle soreness. And by the way, I've used a term that you might consider wonky. It's delayed onset muscle soreness, DOMS, and you hear this term thrown around a lot. Delayed onset muscle soreness, I don't know if we covered it yet. This is a specific type of soreness. It usually sets in in fact, it never sets in while you're exercising. It takes time. There's lag time, 24, 48 hours, that type of thing. It sets in after you're done exercising. It's painful, hurts to move, doesn't hurt much at rest, but it's when you flex a muscle that's experiencing this soreness, you'll know, okay? And it lasts for more than 24 hours, certainly. It can last 3 days, even more, right? So and we're not going to now really digress going into like what causes delayed onset muscle soreness beyond the fact that it's exercise induced and it's unpleasant and Yeah, so self-myofascial release, it can address that. Did I miss anything, Heather?
I don't think so. Okay, so we wanted to just kind of briefly go over what those self-myofascial release tools look like, and Jeremy is going to give us a few demonstrations briefly here, but I just take you through a couple of them. So when we're talking about foam roller, as Jeremy said, we're talking about foam rollers just for the simplicity of terminology, but we're talking about anything that can be used for self-myofascial release. So it could be that soft foam roller that you see that's actually made out of foam, and it tends to have a little bit of give to it, which is quite pleasant when you are when you have very tight fascia. And then you're going to graduate up towards those more rigid types of foam rollers. So you have that firm one that really doesn't have any give, and then maybe moving up towards those ones that have the bumps and the grooves and the forks and the knives that tend to be a little bit more aggressive. Now, the key is really to pick the one that's going to be the right one for you. This is not supposed to be painful. As we cheekily said in the beginning with the title of our session being Circle of Death, it can feel like that at times. And if it does feel like that, you're probably not using the right tool for yourself. It is not going to feel pleasant, but it shouldn't feel excruciating. It's going to be uncomfortable, and that's as far as that pain should go. So Jeremy has a few different ones there that he's pulled out for us. The long one is actually a foam roller, the one that's laying lengthwise on the floor, and he just has it covered with a cover, but it is actually the foam. And then he has the higher density foam roller, and then he has an even stiffer small one, and then the rigid one with the forks and the knives and the bumps. And then, of course, he also has some couple balls that he's taped together, which are really great for doing the upper back. But that balls can actually be very beneficial as well. They get into places that other things can't, and there's obviously different variations of ones that you can use. You can use a tennis ball, which is going to have a little bit more bounce and give to it, and your specialty balls will often have variability in their intensity. And then you have something like a lacrosse ball, which is very popular, but it's also very, very firm and can be quite intense for us. And then in the top right-hand corner, you see the massage stick. So massage sticks can be really beneficial too. One of the things I like about a massage stick, because I have had fascial issues in the past, and laying my full body weight on a full room foam roller was actually just too painful. The nice thing with a massage stick is that you're able to modulate the intensity more for yourself than you are when you're laying your body weight on a foam roller. So you can change the pressure up depending on what your abilities are. But we really want to drive home, choose the right tool for you in this moment. Don't go to the most aggressive thing where you're wincing in pain. If you're having to grimace to do this, it's probably too much.
Definitely. And yeah, so that one that's on your screen right now with the triangle sticking out, sometimes they call these things like trigger point type. Sometimes you'll see that term associated with it. And I'm convinced that this is very medieval looking. If you brought us back like 5 centuries, I think that your average human being would think they know what they're seeing right now on their screen. But so those are the tools of the trade. The only thing I can't show you here today is the handheld one. But what we're going to cover now is a few. Well, look, don't overcomplicate foam rolling. It's not surgery. Okay. But there's just some ways that you could do it. Hold on. There's some ways you can do it a little bit more effectively, a little bit less effectively. So Heather started with the first, which is to choose the right device. Why do you have to choose the right device? Among other reasons, you got to choose the right device. Because if the surface is too dense, if it's too hard, not soft enough, this guy's softer, squishier, right? Then you're going to hide from, you're going to hide the area that really you're trying to massage, right? So, and then you're going to, that just completely misses the point, obviously. So, like I said, first step, choose the right squishiness. Don't go too advanced too soon. Oh, by the way, a carrying case can be handy now that we're sharing these things a lot less. This is like, you can buy one for carrying cases. And you can buy short ones too. Anyway, so that's first step. Second step is well, there's 3 types of movement that you should be using some combination of when you're on your foam roll. So we're going to cover these now. The first is, so there's kneading, there's rocking, and there's, okay, we're going to cover just rolling first. So that's basic, right? Let's say I wanted to roll the bottom, well, the back of my lower leg, okay? The calves, right? Well, so not surprisingly, you just, the surface that you want to massage, bottom of my leg, just put it against the foam roller, okay? And you're just going to go forwards and back, just the length of that muscle. Now, the speed I'm going at here also is roughly the speed that you want to do your foam rolling at. In other words, you could go too fast. You're not kneading a roll of bread here, okay? You don't go as rapidly as that. And you do the whole length as well, okay? And if you don't do the whole length, by the way, well, again, that's for full benefit. All right, so that's the first movement pattern. What's the second? It is rocking, okay? So here is when I would turn one way, turn the other, turn one way, turn the other, along the length of that muscle and the fascia that overlays it. Now, the third way is to, well, it's elongating. So how do you do that? Well, it depends on the muscle. So if this is my calf area, it's the muscle in the back of my lower leg, to elongate that or stretch it, well, you need to curl the toes up, right? Now that muscle is lengthening. So in its lengthened state, the fascia is also going to be a little bit lengthened, right? Because the fascia is sort of sticky, sort of stuck to it. Now apply that pressure. Okay, in either direction. Now, that's the 3 basic movements. Some don'ts to now do, or to avoid anyway. What you want to avoid, this is very important, is any of the movements that I just showed you against a bony joint. So the juncture between 2 joints, let's say the knee, right? Don't roll the knee. I guess there's fascia there, but that's not the type of fascia to do. That's going to induce injury. That's a way you can harm yourself, doing self-myofascial release. But that's not all, right? It's also the vertebrae, really any of the vertebrae in the back, but especially in the lower back. You're not going to do that. And your hips, right? So I'm getting ahead of myself here a little bit. Heather, you stop me if I'm getting too advanced, or too far ahead. But let's say the IT bend, right? So the fascia that is between the knee and the pelvis, right? You're not going to, no benefit and there's potential harm to using a foam roller against that bony joint up here, and as we covered, the knee down there, okay? So yeah, so just for quick review, number 1 is rolling. That's the first movement. I'm going to show you against my IT, just to mix things up, okay? So rolling the length, watch your speed, don't go too fast. Then we have rocking. And then we have elongating, which is very tricky to show with the IT. And I'm basically elongated in this position already. So in some body parts, you're elongated just to get on the damn thing. I suppose if I'd done it standing, it might have been possible to elongate more or less. But we're sort of getting lost in the weeds there. Right. So Heather, I can't see the notes. Should we move on to another slide now?
Okay. Yes. So
yeah, your
what
turn.
is the optimal protocol? Well, to be quite honest with you, there really isn't anything that for us to be able to say, this is absolutely the best thing to do. There are several methods that the evidence has shown us work effectively, and this happens to be one of them. So the suggestion is to roll for about 1 to 3 minutes max per body part. So one method of doing that would be to roll for 1 minute, rest for 30 seconds, and then roll that one area again before moving on to another one. So as I said, there's not really a consensus on what this could look like. There's lots of ways that you could do it, but the key is maybe not to do too much of it. When we do too much, we're probably more likely to cause more harm than we are to help ourselves, because we're just going to end up causing inflammation rather than reducing the amount of adhesion that's there.
What we're going to do now is cover a few, well, think of them as fundamentals, like fundamental foam rolling postures, right? So ways, like areas of the body to address, basically how to do it. Right. So Heather, I don't know, are you able to increase the size of the video so that they can see
Yes,
properly?
you'll lose your the hand. Okay.
That's fine. Yeah. You know what? If you could just
Sure.
let me
Okay,
know
so the
which
first
one's
one is the calves.
Calves. Okay. Well, I showed you already one way that you might do calves. Just for it was just like one leg at a time. Okay. You can do 2 legs at a time. Now that is probably going to be less intense, right? Because now I have my whole body weight distributed against each of my lower legs as opposed to just one on there. Okay. So that's calves. I will say, however, if shin splints is a problem that you're having, I'm not promising this is a cure. Do that, right? But now this is a calves, but this is sort of the inverse of calves. This would be like tibialis anterior. So the muscles that are on the front of the lower leg, okay? Just careful to stay away from the bone. So I'm gonna have to turn around this way so you can see better. So the tibialis anterior, this muscle, it's sort of like the lateral, so the side, it's supposed to be inside side, the side of your lower leg. If you could rotate so that is what's in contact with the foam roller, and then forwards and backwards. I might be going a little bit too fast because we're on camera and I'm a little bit hyped.
So
okay, so that's calves and
second one,
tibialis anterior.
hamstrings there,
Now,
Jeremy.
Hamstrings, oh yeah, hamstrings. It's the most pleasant, I assure you. Yeah, hamstrings is a treat. I don't know why that is. Why is it, Heather, that hamstrings doesn't hurt
I don't
ever
know.
when you feel it? I'm glad we brought it up because I forgot. There's one don't that I should have told you guys about. The other, it's don't roll into pain. Okay, now if you can distinguish tightness, potentially soreness from pain, okay, that's a legitimate target for a foam roller. But especially if it's like a throbbing, sharp, shooting pain when you're on it, yeah, that's another way you could do harm by foam rolling. But you know what? Also, like, if it's that painful, you're probably not going to have, you're going to hide it, right? So you got to, yeah, don't roll into pain. At a minimum, you got to choose a softer surface to foam roll against if you're getting that type of pain. But really, preferably, if you're rolling into pain, yeah, don't roll into that. You know, get help for it. Okay, so hamstrings. Right, so stay away from your knee. Stay away from the bony head of that femur, right? And you can either roll bilaterally. Okay, so that's 2 legs at the same time. Or 1 leg, cross it over. And now I've got twice the amount of weight. Very, very pleasant. That's a nice break. Oh, do that all night. If Heather hadn't told me that I'm not supposed to roll for more than 30 seconds. Yes. Or was it a minute? I think it was a minute. Okay, so that's hamstrings. Let's do piriformis next. Okay, piriformis, the most obscene sounding muscle in the human body. Piriformis, if anybody watched the episode we did, I think it was episode 3. No, this is probably episode 2. It's like one of these muscles, very important for running. Okay, like this one is part of the group that controls the position of that femur inside the hip joint when we run, when we walk, when we stand, I guess, too, which is very important. It turns out that the angle of that femur inside the hip when we're moving, yeah, if it's off, that can cause problems. If it's well positioned, if it's stable, if it's not moving too much inside, not too much outside, if you move, that's much better. So, piriformis, when you run, that can become irritated. I'll show you a way that you can roll it. You're going to start by sitting on your foam roller, okay? So this is a case where, well, it's not that the bony head of the femur is pressed directly. I'd have to sit back to do that. It's more like I can almost feel the bony top of that, the round top of that bone. I can almost feel it pressing into the foam roller, but not quite. Okay, so from this seated position, then just cross one leg over the other. So in this case, this is, because you got two piriforms, right? You got one at the head of each femur. This time I'm going to roll the left, which is from my left, this side. So decide that you want to knead or you want to roll. You cross the matching leg, okay? And then shift your body weight over so that now you got as much of it as you can bear on that, what is from my left side, and then forward and back. Now here you are. I guess this is an exception to rolling over bony processes because the head of the femur bone, that long bone of the upper leg, it is the area that you want to apply some force to. So I guess this is an exception to that rule. So yeah, but I assure you, once you just take your seated position and you just another note. It doesn't matter if your knee is high up or low down. Really doesn't matter. The point is just to rotate that bone in its socket. But I assure you, once you have done that, and then you've rolled over a little bit of your weight onto your piriformis, yeah, you'll feel that right away, and you'll have to be thankful for that. Okay. So that's piriformis, which I think is going to leave probably thighs.
Yeah,
right?
the other one that they have on this sheet is your adductors. Mm-hmm.
Adductors. All right. So adductor, more than one way. Adductors is these muscles that are inside the surface. So not the outside surface of the leg, but the inside surface of the leg, right? So in other words, you've got to expose this inside plane of your leg, okay? So best have a mat while you do it, okay? Elongate the leg. Yeah, I'm feeling that a lot in the top. What are you laughing at?
Because I don't have to do the painful part.
Yeah.
So, Jeremy,
I don't know.
we have a question here from Rhonda, coming back to the piriformis.
Yes.
I rolled on what I thought was my
Yes.
piriformis and irritated my sciatica. Did I do something wrong?
So you have sciatica.
I'm assuming so. Okay.
Yeah. Well, it could be that in this condition, it's just contraindicated for you to roll the piriformis, right?
So one of the
I can't
things we
explain.
often recommend, Rhonda, when you have an area that's injured is to roll the areas around the injury because that can usually benefit that area that is bothered without having to put direct pressure on it until it sort of alleviates or settles down a bit. So that's probably what I would more recommend is maybe rolling a little bit into your TFL, which is connected to your IT band at the very top. Maybe rolling a little bit into those quads and those hamstrings to loosen up those legs may actually help with the sciatica without actually sitting on that piriformis. Does that make sense, Jeremy, to you? Yeah.
That's a good idea. Yeah. Okay. So adductor. Let's just quickly cover the thigh. I assure you, you're going to hate it. If you ever roll, you haven't rolled your thigh before, and then all of a sudden you do it, you're not going to forget the experience. It's going to be either the lowest point of your day or the highlight of your day. Okay. So for rolling the upper thigh, I'm going to show you unilaterally, so one side at a time, right? So I'm going to start with that foam roller, not necessarily towards the knee, but sort of the midway. I'm going to just my other legs off the ground. I'm shifting more of my weight on the side that I'm going to roll. And then I'm going to run the length between the hip and the knee. Now, we covered a little bit how it's possible to hide from tightness as you roll. It absolutely is. For example, if I wanted to hide from this stretch, from this foam rolling right now, I just roll towards the inside of that leg. Okay? And now the pressure is really against the adductor, which for me is not at all tight. That fascia must be in good shape. Okay? But then if I roll this way, well, now I feel a big difference. That's definitely, well, that's not painful, but that's intense. It's brisk. Let's put it that way, right? So my point here is, you can sense this. So this happens when I'm training people, when I have them in reconditioning, and I say, look, you're the one that knows right now. If you are needing, for lack of a better word, if you are rolling the area that is tight, you need to sense that and respond to it. Okay. So do we want to do
I think we probably need to move on to finish on time here, Jeremy. But what we are going to do for you folks is we're going to give you a that has that same chart on it that we just put up. So this is from the Strength and Conditioning Association in the States, and it gives a bit of a descriptor of home rolling as well as a sample routine at the back to do. So hopefully there's some potential there for you if you're not quite sure where to start. Okay. So Jeremy mentioned a few of these, but we just want to leave you with those of what not to do. So don't go for too long. You don't need to torture yourself for hours on end foam rolling. Again, spending about 1 to 3 minutes max on each body part, and just enough time to allow that relaxation to happen, that circulation to increase. And then thinking about not holding your breath. We all tend to want to do this when we're exercising in general, but we really want to think about normal breathing patterns, and then that's going to allow us to actually relax more into the foam roller. Don't roll over your lower back, as Jeremy said. Our spine doesn't particularly like that, especially on the low back where there isn't as much tissue to sort of hide the spine from, and our kidneys don't actually like it very much either. So just keeping that in mind as well. If you have tightness in your back, just as I had just said to Rhonda, what we would recommend is rolling the areas that might be affecting the low back. So that would be things like hamstrings, hip flexors, piriformis might actually be the culprit that's actually causing the low back pain in the first place. Roll over your joint. Don't roll over your joints. So anything that's bony, we don't want you to roll over any bony bits. Your knees, your elbows, your ankles, your hips, your shins. As you saw when Jeremy did the tibialis anterior or the shin, he stayed away from the bone. He was on the side where the muscly soft tissue is. And that's what we're really trying to achieve with foam rolling, is we're addressing soft tissue only. Okay. And the last one, as Jeremy said, is don't push into those painful areas. Allow some discomfort, but don't go into the point of pain. If you are feeling excruciating pain to the point where you're grimacing, back off. Okay. So find a less intense tool for yourself, or prop yourself up. I quite often do that in when I have really intense areas, like my quads tend to be tight. I'll tuck a couple of pillows under my torso to lighten the load that I'm putting on the torso or on the leg at that point. Okay.
By getting talking about what not to do there. In any event, yeah, before we let you go, I want to also cover a little bit about what we're not so sure about when it comes to foam rolling. So I'm not going to necessarily dial back everything we just said, but we're going to couch some maybe things that we've just said here. So you might be noticing that our advice having to do with like exactly how long your sets should be and your reps and how many sets and reps, we've been a little bit ambiguous about that. And that is because it is hard to be actually, well, while being evidence-based, while being prudent, it's hard to actually give you hard and fast, discrete rules about that. So at this point, it's difficult to say. I mean, I would say if your physical therapist has advised a course of action, then you should be, doing that. But other than that, if it's a little bit tricky. Okay, another one is athletic performance. Look, if what you have is you have a muscle that is not functioning well because its fascia is too tight, if you can loosen up that fascia and the muscle becomes more mobile, it's a straightforward premise that can increase athletic performance. But whether or not foam rolling can take an existing healthy muscle, healthy fascia, and augment its performance, yeah, that's not clear. I mean, it's not clear one way or the other, right? So, okay, so that's one area we're not so sure about. Again, I've mentioned that foam rolling, especially like as a recovery, something you do while you're recovering from exercise, this can potentially deal with delayed onset muscle soreness. That's, all I'm going to say is it can do that. There's sort of a measurement problem here. Like how exactly in research do we know if delayed onset muscle soreness exactly has come down? Look, it's not exactly, well, I don't think it's a foregone conclusion. And the other thing is different subgroups, okay? So beyond just like men or women, I think like age group differences, I'm very curious to see what the research has to say about that over time, especially like if the elderly, I wonder if the elderly can benefit really from self-myofascial release even more than the rest of us. But in any event, suffice it to say, it is an area of, it's an area of research. So, but nothing that I've just said, well, look, the main point of what I just said is that it is possible for foam rolling to be a waste of your time. Okay, I mean, if every uncertainty that I've just laid out for you ends up like falling on the wrong end of the equation, as in like every positive thing that we were in doubt of turns out to not be true, and every negative thing that we were wondering about turns out to be true, even then, this is likely to just be a waste of your time, right? So it's hard if you're doing this properly for it to be something that's going to actually set you back or cause injury. So
Okay.
I think that's all I want to say
Sorry
about
to give you guys the download. So we just have our last little bits, and this is our resource sheet. I just really wanted to highlight too, one of the reasons that we opted to pair up with our reconditioning team was just to let you get to know the teams that are around the country and what they can actually do for you if you are have been through physiotherapy or have been through a diagnosis and have been referred to them. It's an opportunity for us to be able to highlight what they do and show you what they're capable of if you haven't had the opportunity to use their services in the past. The other thing I want to highlight that's not on here today is our DFIT website, which if you're just not sure where to start, but you have probably enough knowledge to go into the gym relatively safely, there's lots of great programs on there that can be really great to get you going in the right direction, especially with your strength training. And lastly, we're going to leave you with our only poll that we have left today. Sorry, guys, I think I hit the wrong one. There we go. All right. And you're the only answer, so you can answer honestly. Right. So that is it for us today. Next session, which is 2 weeks away, same time on Monday, is going to be, as Jeremy had said, on neutral spine and maintaining neutral spine with movement. So we hope that you will join us then. Well, we hope to have Jeremy on screen again and doing some of his wonderful demos again. So hopefully that's going to work out for us. Thank you very much for joining us today, guys. And we will see you in a couple of weeks, hopefully. All right. Thank you, Jeremy. Bye.
Bye now.